Hey, everybody. Good morning, and thank you for joining us. Welcome to Invisible Condition. It's not all in your head. I'm your host, Jeff Pearson, and we want everybody with an invisible condition, no matter what that condition is, to know beyond the shadow of a doubt that you do have a voice, you do have a community, and you are not alone. And today, I have an amazing guest. We are not alone today either. We've got an amazing guest today. Dr. Alex is with us, and he has been consulted over 300,000 times and has witnessed firsthand the complex interrelationship between mind, body, and spirit. And we're going to explore that today a little bit. Dr. Alex is the creator of the Transformational Acupuncture System, which is really cool, and I'm excited to learn about that. You should be too. It's going to be great. And he is one of Australia's foremost thought leaders in the management of depression and other mental illnesses. And so we are going to have an amazing discussion today. I can't wait for you to meet him. Let me bring him on real quick here. Hey, technology worked. Yay.
Amazing. Thanks, Jeff.
All right. Welcome.
Yeah.
So let's get to it here. You've been in the medical field for a long time, right?
Yes. I graduated in medicine in 1979. So there you go.
Okay. Well, yeah, that's a long time. That's yeah. So what made you want to be a doctor? What was that initial spark there?
That's a good question. I guess the idea that I didn't at that age have a lot of experience of having conversations with people and dealing with people and their issues. And I had the chance to be an astronomer, and that was my initial, believe it or not, initially what I wanted to do. But then I thought, I'm going to be up all night and asleep all day and never come in contact with anyone. And the idea of being able to help people. And I think the passion wasn't really ignited until in medical school, I had a term in general practice as a sort of a work experience. And I just thought, this is for me. And I could imagine that in a scenario that's not super technological, when you're dealing with people in their everyday life and so forth. And helping to explain to the average person what all their health issues are in English rather than medical jargon.
Right. Thank you for that, by the way. Yeah, we need more people like that. We need people that speak English in the medical industry. Yeah.
And interestingly, fairly early on, even when I was working in the hospital, I had a passion for taking patients off medications rather than putting them on. It just seemed like every medication I stopped, it was like some sort of little victory because the person didn't need that artificial assistance anymore.
I absolutely love that, because you're absolutely right. In the United States anyway, I don't know about Australia. Maybe it's similar, but in the US, it's way too common for people to be on, I mean, multiple medications. And
Yes.
when one doctor prescribes, I don't know how many, like you go to one doctor, they prescribe you some stuff. You go
Hmm.
to another doctor, they prescribe, they don't talk sometimes.
That's
And so
right.
you don't know if those meds are going to mesh well, or if the side effects are going to clash. I mean,
Yes.
you're really playing with it's like Russian roulette here with medication
Yeah.
almost.
Yeah.
So
True.
yeah. So getting them off is better. Yeah. That's, I love that.
Yeah.
So did you, so was there something, was there something that happened? Like, I know that happened before you decided to, or what that kind of sparked you to want to be a doctor? Like something happened with somebody you know, or somebody you're related to, like a,
Uh,
oh, this is what I want to
no,
do.
it wasn't so much that, but I guess in my younger days, I was very much a head person and
Mm,
full of, I loved learning facts and applying that in life. And
yeah.
that was generally my approach to things. And then it was actually, what was it, 92, I developed Crohn's disease.
Ooh.
And which, for those of you who don't know, it's a severe chronic abdominal problem with
Mhm.
lots of abdominal pain. And but I hadn't appreciated how ill I was. Being a doctor, I was self-medicating with some mild painkillers, which seemed to give temporary relief. And I basically collapsed at work one day, and my
Mm.
wife said, "You got to see a doctor about this. If you don't, I'm going to divorce you." So that forced me to go and get myself checked out, and within 24 hours I was hospitalized, and a week later had 2 feet of intestine cut out of me.
Oh.
I had I had 2 4-inch abscesses in my abdomen that had fistulated off the bowel, and so I was quite septic and quite ill.
Oh,
I
good Lord.
was, I was 20 kilos lighter than I am when I finished the surgery. So
Yeah.
so I was quite sick, and the thing was, the operation was successful, for which I'm eternally grateful. And I said to the specialist, who was known to specialise in Crohn's disease surgery, I said, what diet should I follow after this? He says, don't worry about it. He says, you're cured. Eat anything you like. And I go, you beauty. And then within 6 weeks, I started getting symptoms again. So a mate of mine was into nutritional and environmental medicine, and he said, "Come and see me." And he gave me mega doses of vitamins and minerals, and took me off gluten, dairy, sugar, meat, nuts. I was on a very bland diet, but the thing was, the symptoms disappeared, and I improved dramatically.
Oh my gosh.
So that sort of sparked my interest in, okay, I thought I understood how the body works, that I've been to the best medical school, certainly in Australia. And how comes I didn't learn any of this in medical school? Because certainly in those days, there was no real medication for Crohn's disease. There is some now, but that's not without significant side effects, potential side effects.
Right.
So that's what started me on this whole journey of looking at for alternatives and complementary, it's called nowadays. But the idea is, you're looking for something other than a drug or a surgery to fix a problem.
Well, yeah, and I mean, it's right there in the Hippocratic Oath, right? Let your medicine be your food be your medicine, and first and foremost, do no harm, like all of that
Yes.
stuff, And I feel like over the last 50 to 100 years, we started off really like well-meaning, but I think we've lost sight of some of that now, and so that you're getting back to it, and like, it's a beautiful thing, because there's so many doctors that I know of that I've not been to them. I've had amazing doctors for most of the times that I've need to go see them, but there are still plenty out there that rush to medication, and it just it's just medication should be a last resort, in my humble opinion. I'm no doctor, but that seems like there's
Yeah,
less side effects if you're not taking a medication with side effects,
yeah,
So
yeah. Well, that's exactly right. I mean, I tried various alternate practices and medicines and so on, and really the best of all was acupuncture. Just seemed to have a knack at it. I went to initially just a 3-weekend workshop, and by the end of the second weekend, I already had some patients in mind and said, "Do you want me to try acupuncture on you?" And they were going, yes, because these were patients who, with particularly chronic pain, like initially it was mostly knee pain and hip pain from arthritis, and they couldn't tolerate medications very well. And they were on waiting lists for surgery. So I said, well, what have you got to lose? Let's try some acupuncture. Right. Yeah. Well, so, I was amazed at how much improvement patients got. And it was a case of them telling their friends, who then started coming to see me. And fairly soon I was quite busy with acupuncture, running it at the same time as a general practice. And wow. Yeah. And so initially when a patient would present with a problem, I would say, I'd go through all the usual process of what options are available, but acupuncture was really a matter of last resort where everything else had failed. And within a matter of a few months, I was offering it as an alternative to patients. We can do this, or we can try acupuncture. And then a year or two later, I'm saying to people as they come in, well, let's try acupuncture. If you don't respond within, 5 or 6 treatments, then we'll do all the tests and so forth. Because it's just amazing how many symptoms just settle with acupuncture.
Nice.
And it's quite holistic in that it's very difficult to just treat one part of the body, if you know what I mean. It's treating the whole person. So often the symptoms that are quite unrelated to the problem they present with dramatically improves in a matter of half a dozen treatments or so.
I totally agree. Well, it's so funny that you did what you just said there. Kind of reminded me of something. I went to somebody in Oregon recently, a few months ago, to get some pressure point therapy on the vagus nerve. And the vagus nerve, for those who don't know, you do, I'm sure, but it starts up here at the brainstem and goes, just branches out into everything. I mean, there's parts of your vagus nerve that are in your feet and your toes, right? And so and I didn't know this, but apparently the nerves that are in your toes correspond to your sinuses. Apparently, that's what they told me anyway. And so it's like it's talk about disconnected but connected. It's like, wait, what? And so and so, by the way, everybody in the audience, I just want to throw this out there while we're here. If you have any questions for about anything, especially about like Crohn's or acupuncture or any, this is the expert, right? Where is it? This way, this guy right here. Here's the expert. He's the one you want to ask the questions of. We're gonna, in fact, I'm gonna put it up right now. If you have questions, scan that QR code. That'll go to his website. Yes. Contact him through there. Is that the best place to contact you?
Yeah, because I've got a section there for doctors and a section for acupuncturists and a section for general public.
Okay, I love it. Yeah, so it should be super simple. Once you get there, just go to the section and reach out. So I'm going to leave this up this will probably be off and on for the majority of the show, just so you have plenty of chances to scan that QR code and make contact if you're interested. So or reach out during the show, if you're watching on Facebook or LinkedIn or YouTube or wherever, somewhere you can comment, reach out and comment, and one of us can get back to you and I can get you in touch or whatever works, but we want to, that's why we're here. We want to address things and answer questions. So I love that shift you made though. I was hoping that was the direction you were going to go with that. Like you started with acupuncture as the alternative, and then you kind of went, wait a second, maybe traditional medicine should be the alternative. We should start here. Is there any harm in acupuncture? Like if you try acupuncture?
No, it doesn't really make anything worse.
You're right.
The majority of people will get some degree of improvement, some absolutely fantastic, and a small percentage don't really get any improvement. But it doesn't make them worse. And you usually know within half a dozen, perhaps 8 treatments, whether it's going to help you or not.
Yeah, and that's, you know what, that's true with most, shall we say, holistic or naturopathic, you know, non-pharmaceutical, non-medical things. You know, most of those things won't hurt you. If it doesn't work, it doesn't work. Like if it doesn't improve you, it does, but it's not going to hurt you. So, which is vastly different from a lot of things in the medical world.
Oh, that's absolutely true.
Yeah.
You know, it's the only procedure I know of really where a patient can drift off to sleep while they're in the doctor's office and wake up feeling refreshed and energized. I mean, most procedures doctors do are quite painful and unpleasant.
Yeah, well, yeah, I don't remember the last, short of having that mask put over your face for anesthesia and being knocked out, you know, for surgery. I don't remember the last time I fell asleep in the presence of a doctor, a traditional doctor. You know, you go in there and you're not relaxed. Okay.
And the thing is with acupuncture, I mean, even you know, on a fairly regular basis, people will fall asleep before I finish putting the needles in. You know, it's just that powerful a treatment.
So is it? That seems unbelievable to me. Like I had some what do you call it? It wasn't acupuncture. It was can't remember what it was. It was something else. It had needles involved, but it was for a joint pain I had or something. It wasn't. They didn't call it acupuncture. It was needling, dry needling.
Dry needling.
Dry needling. Is that anywhere close to acupuncture, or is it?
Well, yeah. I mean, you're deliberately trying to stimulate the muscle, so it can be quite painful.
Yeah, it is.
Painful points. I mean, the technique I do is quite gentle, sort of along the line of Japanese acupuncture, in that the Chinese people and the Japanese people tend to have different personalities. And the Chinese, if they go to an acupuncturist, they expect to get pain, you know, no pain, no gain type of thing. Whereas if Japanese go to an acupuncturist, if he inflicts pain on them, they don't go back again. So,
interesting. Okay.
Yeah, it's quite different. And so the technique I use is quite gentle, and because what we're doing is trying to work on the person's the level of consciousness, the mind, body, and spirit. So rather than a physical problem like a painful elbow or something like that. So I mean, you can use it to treat the painful elbow, and usually you don't have to put any needles in the painful part itself, which for some people, they're very happy about that.
Yes. Yeah, I was kind of shocked that he just went straight for the elbow and started, you know, the more you put it in there, the more it hurt. And I was like, okay, this is not. Oh,
it's different approach. Yes, that's not really acupuncture. Where acupuncture, there's a whole series of points around the body that have an influence over the various internal organs and the brain.
Yeah.
And I mean, the technique I learned that I do now, which I call transformational acupuncture, you know, it really helps mental problems, particularly depression and anxiety. And in that situation, you're really trying to be as gentle as possible, because you've already got a person who's half freaking out about, especially when they've never had acupuncture before. Right. So, you know, you need to gain their trust and help them relax. And so,
which is another thing that inflicting pain doesn't help either.
Yeah. Well, you know, for most people, it's not painful. You know, most of the time. And, you know, for those who are skeptical or apprehensive about it, I'll say, well, let me just put one needle in and see how you go. And I do that. And then they go, oh, is that all there is to it? And I go, yep. And then before you know it, they've got a dozen needles in them and they don't even realize.
And they're half asleep.
Yeah, exactly. Because
that sounds glorious, actually.
Well, I mean, there's a particular point called G20, which is on the top of the head there. So the Chinese name is Tian Man, or celestial fullness. And sometimes, especially with people who are anxious and so forth, when you put the needle in, it's like within seconds, it's like a plug's been pulled out and you can see them drifting off. They, they stop talking to you and go into themselves and that. It's really quite amazing stuff.
Oh my gosh, that sounds incredible, man! I kind of want to now. I want to come. I got to come see you now. That sounds glorious. Oh my gosh! Well, I tell you what, man, we need to take a short break. We are at a good spot for that in the broadcast, so we're gonna just take a couple minutes to highlight a couple sponsors here, and then we will be right back, and we're going to talk more about the connection kind of between acupuncture and mental health too, because there's a connection there that we want to, that I kind of, and especially with the invisible conditions that we're addressing with 99% of the people that are on this show. I think that'd be a valuable thing. So let's on the other side of the break, though, don't go anywhere. We'll be right back as soon as these ads are done. We'll see you in a couple minutes.
Host of the Health Revolution TV show. Join us Tuesdays and Thursdays live, 10 a.m. Pacific, 1 p.m. Eastern Standard Time, where our mission is simple: engaging conversations, elevating health and wellness, empowering transformation. Right here on the Achieve TV channel on E360 TV.
Welcome back, everybody. And like we were talking about in the beginning of the show at the first segment, you were talking about Crohn's. You were talking about, that can be brutal, actually. That is an invisible condition that can, people don't really understand how painful that can be. So did acupuncture, obviously acupuncture played a role in bringing you relief from that as well, didn't it?
Yeah, well, that and other things like shiatsu, seeing a naturopath and an iridologist and all sorts of things, because I was desperate. That's one way of putting it. And I guess as a doctor, I've always been practical. It's like, if you find something that works, you use it, even if you can't explain why it works.
Yes.
It's like acupuncture. A lot of doctors sort of poo-poo the whole thing just because it doesn't, the language doesn't make sense to them. And therefore they say it can't possibly be real. But it doesn't take long to have a treatment to find out that it has a real effect on you, even if you don't understand it.
Well, and isn't that the case with so many things? What I mean is, people have to be desperate before they try something different.
Yes.
For instance, I had 2 brain surgeries within 24 hours in 2014 because of an infection in my cerebral spinal fluid. it was successful. Eventually, they got done what they needed to get done. The device, the shunt was replaced, and by all accounts, by the doctor's estimation, everything was cool. But I had nonstop migraines for better part of a year following that surgery. And I kept going back to the doctor saying, what can we do about that? To the surgeon, what do we do about this? What do we do about this? I've gone to doctors, I've gone to, gotten medication, whatever. And he said, well, I guess you're just going to have to live with headaches. I said, no, sorry, I'm not accepting
Not
that.
an option.
No, thank you. I don't want to live the rest of my life on a couch. And so, wouldn't you know it, I found a couple things that actually got rid of those migraines, and I've never had another one like it since. I've had other headaches, believe me, but I've never had anything like that with that kind of consistency since. And it was all because of a naturopathic kind of thing that I found. And so, why is that last resort? Is my question. We should be the traditional medical model and the alternative model or natural model, whatever you want to call it, should be working together. And I don't know why they're not. Are they? I mean, it sounds like you're able to work them together a little better in Australia. A little bit.
Well, our Medicare system does allow acupuncture treatments as rebatable, so that helps.
That is nice. I mean that they even entertained that kind of thing as something that is covered or whatever. Is, fantastic. So let's talk a little bit about Transformational Acupuncture International.
Yes.
Tell us about that.
Well, I set that up basically to train other acupuncturists around the world in this method, and because I've been working as a GP for 42 years in the one practice all this time. We built it from a solo practice up to a 12-doctor practice with allied health people and nurses and a ton of receptionists. And it was a case of realizing, well, I've discovered a method which consistently helps people with depression and anxiety. And I thought, well, I can't even treat the number of people in the city I'm in, let alone the world. And there's an estimated 280 million people in the world with depression, and double that number with anxiety. And I mean, and it's not only just those number of people, but of course, depression affects the whole family, and it affects the work environment and lost days at work and so forth. So I decided I should train other acupuncturists in this method, and I started in 2017 with workshops in Sydney and Melbourne and Brisbane and so on in Australia here, and with success, And so, well, with the event of Zoom and all those other technological wonders, I now reach acupuncturists around the world, particularly the US and Canada and UK.
I mean, we wouldn't be here doing this if it weren't for technology, right? I mean, say what you want about Zoom, but it has opened the door to so many things. I mean, I know we're not on Zoom today; we're on a different platform, but there's so many platforms like it that wouldn't be around if it weren't for that. And so I'm kind of thankful that's around, and you've been able to. I mean, you've taken full advantage of that. I love that.
Yes, yeah, absolutely. So, it's just as easy for me to teach this method, over video like this, as talking in the flesh.
I love it. And so do people just make appointment and like have a series of education?
Yeah, well, usually,
or is it a course that you've published, or is it, how do you do it?
The actual treatments themselves.
Okay.
Is usually once a week for 8 weeks.
Oh, wow.
Which coincidentally, the training is once a week for 8 weeks. That's what happened. Seems like a good number. But during that time, most people will settle, the acute symptoms will settle down. Wow. And then with less frequent intervals, but over a longer period of time, I've got many patients off of antidepressants over the years.
That's
In
huge.
fact, absolutely.
Go ahead, sir.
I was going to say that I really became aware of this. I've been doing acupuncture for like 15 odd years, and I'd come across a system that helped. Well, it wasn't really a system, I suppose, but a method of helping raise people's consciousness, which was to be used on people who meditate a lot and don't have any mental health issues and so on. And I thought, this works really well, but how many people do I know like that? Most people come to see me because they're unwell, not because they're well. So, but me being me, I experimented and I found people with various problems like low back pain, for example. When I treated them according to this method, not only did their back pain improve, but the effect was longer lasting, and mentally they felt much better. And I've had people saying, well, I don't get into arguments with my wife anymore, or I don't have, I have the same problems at work, but I just deal with them. It doesn't trouble me, and sleep better and so forth. And
nice. But
it really hit home when I had one woman who had been coming to our practice for years and usually seeing one of the other doctors, but she had widespread osteoarthritis, and the pain wasn't being controlled with just paracetamol, Tylenol. So the doctor put her onto opioids, fentanyl patches, which, relieved the pain, but she didn't feel good on it. And so she came to see me, and within, after third treatment, she didn't need any of the painkillers anymore. And so she's saying, this is really good. Let's keep going. And then after a couple of months of treatment, this is like about once every fortnight or 3 weeks or so. After a couple of months, she said, can I stop the antidepressants? And I said, tell me more about it. And she had been on antidepressants for 16 years. This is a woman who at the time was about 60. And I thought, well, maybe she just doesn't need to be on them, and she's just been taking them through habit. You see the doctor and get the repeat script. But no, I checked the records, and her GP had tried to withdraw her health off them the previous year. And within 6 weeks, her symptoms returned. So I said, you've got to take these for the rest of your life, sort of thing. So I was a bit cautious, and I said, well, let's do it slowly and cut the dosage down bit by bit, and over another month got it off them, and that was in 2011, and hasn't needed them since. She hasn't needed painkillers since, apart from the odd Tylenol. She still sees one of the other doctors in the practice. But one of the really things that hit home for me is that even though she was taking the antidepressant, and presumably it was stopping her feeling depressed, when she came off them, she reacted a lot more emotionally to things on the television. And then this was just before Christmas, and one day she got a knock on the door, and our Christmas carolers singing to her hymns, and she just burst into tears and felt this elation and joy in her heart. And she said she hadn't felt that feeling for so many years she couldn't remember. And so I realized that, and through other patients as well, I've realized that, okay, antidepressants dampen down the emotion of the depression, but it dampens down your response to any kind of emotional response. So the good as well as the bad. So most people, not most, but a large percentage of people on antidepressants go through life not actually experiencing any joy or happiness, really. They just, like machines, carry on.
Yeah. Well, so two questions. As you were talking about that, and I am just blown away, because I love these kind of stories. This is awesome. I love hearing this kind of stuff, because it just reinforces what I've been learning over the last few years, and it's just so cool to hear. But two questions. So number one, is acupuncture similar to chiropractic in that it's not one and done? It's sometimes you have to maintain it. Right? It could be a long-term thing. You don't just do it.
Yes, it can be. I mean, it's like going to the gym, really. You don't sort of walk
yeah.
away from the gym the first day and say, woohoo, I got my muscles, I'm right.
Yeah.
It takes time and effort. But very quickly, people find that the acupuncture effect it goes deeper and lasts longer.
Nice.
So it's not like you have to come every week for the rest of your life.
Okay.
It can be every once a month or even once every 3 months for those who are really on top of things.
Right on.
It seems to work well, and most people really enjoy it. So they enjoy coming to have a treatment. It's not like it's medicine.
It's like a little nap, you know? It's
yes. Yeah. And I've got one particular patient who always says every time, I always feel better when I leave this place after coming. You can just see it in him. He lights up.
It's a beautiful thing. That's awesome. That's what you want to hear, though. That's
yeah.
But
I think I used to come home and tell my wife these stories all the time, and she's a GP as well, a medical doctor.
Nice.
And she says you got to research this. You got to follow it up, and then with that patient with depression, she said, like, that's it. You got to. This is too important not to do anything about it. And because I said, well, I don't have to prove it because I know it works,
Yeah.
But the thing was, I followed 6 people then for a year with depression, and they all improved and really quite dramatic, and it was life-changing. Just thinking of one particular one who presented to me with migraines is the situation, and she was quite incapacitated with these migraines. She's around 50, and she and her husband had, with the kids, had moved from Sydney to the bush, as we call it, to a remote town. They call it a tree change. It's where you move from the city to the country. And they bought a little farm and thought that they would be very happy on it. But it turned out, it wasn't producing the money, the income. And her husband was working away from home a lot of the time. And she was feeling quite lonely. And also this was out of town, even the remote town, it was out of town. And she was feeling quite isolated and then getting incapacitated with his migraines. And to the point where she would take the kids to school, come home and go back to bed until it was time to collect them from school again. And that was how she functioned most of the time. And she had tried antidepressants with her previous doctor, and that didn't help. And she had even done, taking mega doses of vitamins and so on, and it didn't really make any kind of shift for her. And she'd done counselling, and that didn't seem to help either. And as a last resort, a friend of hers, who was also a patient of mine, that said, go and see Dr. Alex for acupuncture. And she was a trained lawyer and quite skeptical about alternate therapies, but like me, was desperate enough to try these things. And she was blown away by how much she improved. And even on I think by the 4th or 5th treatment, she noticed that when she was lying there and thinking certain thoughts, she could feel the beginnings of a migraine, the tension in the muscle and the migraine starting. And so she made that connection between her mind and her body, and actually made the commitment not to go down that path. And that changed her life. And it got her talking with her husband and about their home situation. And he didn't like working away from home either. And he said he only stuck out this farm because he thought that was what she wanted. And she said she was only sticking it out because she thought it was his dream. But when they started talking about it, it just really, it changed everything for her. And he's from Europe, and they decided to move there to be close to his family in Europe. And it was a complete life change for her. And she hadn't done anything with her lawyer's skills on the farm. She was doing nothing. But in Europe, she got employed by a multinational company doing, helping various causes and it's just sort of changed her life. And literally a year after I started treating with her, I rang her, and she said that she was having the time of her life. They were just about, her and her husband were just about to go out to the opera, and this was in the Netherlands, and that the kids where they were in Australia, their grades at school were really dropping, and they were getting behind because they could see the irritation and the desperation with the parents.
Sure.
And yet there they were thriving and learned a new language, and school was exciting for them, and so on. So it was so it was life changing, and and that was some years ago. I think that was 2012, 2013. So she hasn't really looked back since, because we keep in touch via Facebook and whatnot, and and life's still great for her.
Unbelievable. I love that. That's so cool. Oh man, see, these are the kind of stories people like, man. I love that kind of stuff. That's beautiful. And I'm sure you've got more. I want to hear more. We'll do more of that in the last segment. We're gonna just, this is a great place to break, because I want to keep going, but we're gonna do one more break, and then we'll be right back. And I want to ask you that second question I had for you, and then I got a question I ask everybody that comes on the show that I want to just see what your answer is, because I'm sure it'll be good.
Sure.
So let's we'll be right back, and we'll just see you in a couple minutes.
Eva Black Occurrence here, and I am the host of One Punch Superstars, where we meet real people who chose to fight for their hopes and their dreams and become the champions of their destiny. You can find us on Achieve TV every Tuesday and Wednesday at noon Mountain Standard Time, right here on E360 TV.
Welcome back, everybody. And I have a question that was still kind of gnawing at me from, and I know the answer you're going to give on this one. I know the answer, but I still want to ask it because with acupuncture that we were talking about, so what we were talking about the acupuncture being a last resort, and which is very true of so many naturopathic things, but and medication seems to be the first go-to, right? That's what we're conditioned to do. Yes. But what side effects does acupuncture have?
Side effects? Well, basically none, really. It can because it's shifting energy. Energy gets stuck. Like depression's a classic thing where a person stays in bed all day long, they don't move, they just glued to the TV or a computer game or something. It's actually shifting things. So if things are stuck, and when you shift these things, sometimes symptoms can become worse. If it happens, it's usually in the first 2 or 3 treatments, and it's often only the one time. It's like often people might feel really calm and feeling fantastic when they leave the clinic, and then later that day they can have like a real outburst with their husband, and they give them what for, where they normally mild and meek. So it's a letting go of years worth of pent up frustration and so forth. So I don't know if you call that a side effect, but certainly.
I think my point was to contrast the that took what 20 seconds for you to say that, and I don't know if you watched a pharmaceutical commercial on TV lately, but they're about 2 minutes long, from what I remember, and they're about 10 seconds of here's how it helps you, and then the other minute and 50 seconds is here's how it kills you. Here's how it could kill you. So the side effects are basically zero compared to.
I mean, even most times people are surprised who've never had it before to realize you don't even bleed with it usually. I mean, you might occasionally get a drop of blood, but normally no. And even patients who are taking blood thinners for a variety of reasons can still have acupuncture, unless their blood's really thin. And I mean, the chance of puncturing a lung, you have to be a really bad acupuncturist to do that. I mean, I've seen one case in about the last 30 or 40 years.
Oh, wow.
Which was done by not a well-trained person.
No, I wouldn't think so.
It wasn't, licensed to do that sort of thing.
No, that's unbelievable. Oh, man. No, because you're not.
No, that's pretty bad. And, you'd have to be pretty incompetent, I suppose is the word. So, if you're getting a licensed acupuncturist, you should be right.
I would hope so. So, well, all right. That was kind of. I ran a sort of.
Go ahead. I mean, I ran a trial of about 70 patients, giving them 16 treatments on a weekly basis, and one thing that stood out at the end was that nobody had said they listed a side effect from the treatments.
Love it.
So, that's pretty good, I reckon.
That's pretty awesome. Yeah. I mean, that's what you like to hear, I mean, I don't know why people don't, I don't know why, again, why is it such a last resort? If there's no side effects and it's not going to hurt you to try.
Exactly.
So, well, I have a question for you that I ask everybody that comes on the show, because I mean, living with Crohn's, going through all that and coming out the other side, doing so much amazing work for others and spreading this acupuncture, being able to teach people how to do it. And just, I mean, it's amazing how you've turned that around to something cool and positive. So I wanted to ask you, on the hard days when if things are painful or if you're having a rough day, how do you find hope?
Well, the feedback from the patients in terms of doing the acupuncture, even when I think, I haven't done good enough for them today, and they finish the treatment and they say that was fantastic, thank you very much. So it's always lifts me.
Nice.
And personally, I wear bright clothes. I don't know if you can see the shirt I'm wearing, but that's just one example. And that was because I was I'd been to Fiji on a number of occasions and for holiday, but also I was actually treating the villagers nearby with acupuncture. I'd have the community hall in each village with about 30 or 40 people, giving them a treatment simultaneously. And yet, so that's a lot of treatments and a lot of the needles in a short time. But I would feel energized and happy and content, not exhausted and drained afterwards. And I talked with my wife and I talked about how can I maintain this feeling when I'm at work. And she suggested I get some the Fijian bulla shirts. They're like Hawaiian.
Yeah.
So I thought, that's a great idea. Let's try it. And I did. And not only did I feel better wearing these shirts, I felt like I was in the zone. Also, I found my patients were smiling, like when you're treating depressed patients, that can be depressing. But, to see them smile and they go, oh, wow, that's a really bright shirt. Oh, that's my favorite color and so on. And, and then I get patients then coming and wearing bright clothes to try and outdo me. So a bit of competition, and that was good fun, natured. And so, that sort of thing, depression sure, it's a condition, and quite a serious one, but you can do things to change it. And just even a simple thing as wearing bright clothes, because a lot of people who are depressed are wearing quite dowdy clothes. They don't look after themselves and so on. And physically getting out and walking around, going for a walk. And, you talk about people being grateful for what they have. I mean, you can always find something to be grateful for, even if, like with me this morning, the sunrise, you just think that's just amazing. And it doesn't cost a cent, and just a few minutes to observe it, and it's just amazing. So there's always something to be grateful for. And I think too much when you're depressed, it's easy to go inwards and focus on yourself and everything that's wrong, and don't see a way of moving forward. But just physically getting out there and walking around and thinking about things that you can be grateful for can make a huge difference.
I love that.
Huge difference.
Yeah, it's true. And one of the things that apparently I have been caught saying a lot over the years is your attitude is the only thing you have 100% control over. Right?
Well, that's extremely true. Yeah, it really is.
Yeah,
it seems it's something you can't put a value on, but the power of it is really is true. I mean, all these successful people in life, they've all, they still have the same problems as everybody else,
or bigger ones even.
Even bigger.
Yeah,
and it's just how they deal with it is the difference.
Yep, exactly. I love it. Well, I tell you what, we've got about 2 minutes left of the show. I know time flies. We're already here. But is there any last words of wisdom, or any lasting thing that you want to leave everybody with before we go?
Yeah, well, with acupuncture, try it. You've got nothing to lose, really, except your depression. Right. And anxiety, even post-traumatic stress disorder, all sorts of conditions I've seen improved by this.
Nice.
And so it's got to be worth trying. On my website, I have a list of practitioners around the world that I've actually trained, and the numbers are small at the moment but growing. So hopefully you'll be able to find somebody near enough to you to try it out. Or if not, ask them to contact me, and I'll talk to them about it.
And you'll train them, and then it'll be somebody nearby.
Absolutely. Because that's my goal, to help as many people as possible. And so I do think big.
Nice. I love it. Yeah, no, I love that's how your website is set up. I because that was going to be my next question. You beat me to, you totally beat me to it. You read my mind. I was going to say, how do people find somebody that was trained by you? But there it is. Yes. So that's amazing. I love it. Well, thank you so much for being here and for being so open about what you've gone through and how you've changed it for good. And the moral of the story for me after listening to you is, please don't wait until you're desperate. Try it as a first resort, not a last resort. I love how you've kind of flipped the script on that. So I love it. So thank you so much for being here.
It's a pleasure, Jeff.
All right, everybody. That was awesome. We got to do that again. I know I say that if you watched for a while, I know I say that about almost every single guest I've had, but we got to do that again. I'm sure there's more we could talk for another hour about. I'm sure. So maybe we'll see him on the show again. I don't know. We'll see. But that was awesome. Maybe next time he'll say he's grown as there's this many more people in the world that are working with him. That'd be great too. So anyway, if you are somebody who has been watching for a while, thank you for being a loyal watcher. I so appreciate you. And if you're new, welcome. Thank you as well. And if you have a favorite episode, share it, because if it's your favorite episode, it's probably somebody else's too. And share away on social media, and join me for the next show that will be on Friday, February 23rd. And until then, have an amazing day, and we will see you next time.